most of these are going to be decreasing inflammation. Yes?
Yes.
Okay. These drugs, I will tell you on this sheet, are probably some of the highest tested on ATI and HESI and NCLEX. Okay? So y'all definitely need to know these. All right. So inflammatory bowel disease. What is ulcerative colitis? I mean, you can get most of it from the name, even if you don't know. So, ulcerative ulcers in your colon. That's inflamed. Good. What is Crohn's disease? What type of disease is it?
Inflammatory disease.
Well, yes, but what type of disease? Is it genetic? Is it autoimmune? Is it bacterial? Is it viral? What is it?
Isn't it?
It's autoimmune. So Crohn's is an autoimmune disorder that attacks the gut, obviously causing massive inflammation. Okay, you with me? Okay. All right, so we're going to talk about the drugs that we can use to treat ulcerative colitis and Crohn's to like tell your gut, like, settle down. Now, this is very important you understand what I'm about to say. In nursing school, we do not use antidiarrheals ever. You will never pick it on an exam. Just like we don't do cough suppressants, right? Unless there's extreme circumstances. And in Crohn's, there is an extreme circumstance. Their gut is so inflamed and so pissed, they may have 25 to 30 bowel movements a day. That is not sustainable with life. So that is one of the only times in nursing school we will give an antidiarrheal. Am I very clear?
Yes.
Okay. Other than that, if a patient has diarrhea, they need to get the poop out. Because if they have a bacteria or a virus in their gut and you stop their poop, what's going to happen to that bacteria and that virus? It's going to stay and it's going to replicate, and you're going to make them real sick. Do you understand? Mm-hmm. The only reason we are allowing it with Crohn's is because Crohn's is not a bacteria. It is not a virus.
It's an
right?
autoimmune disease.
It's an autoimmune disease. And if they keep pooping 25 to 30 times a day, they're going to get electrolyte imbalances and iron deficiency anemia and all kinds of things. They have to be able to work and live, right? All right. So the top two are antidiarrheals. The first one is called Diphenoxylate. It's what y'all probably heard of it as Lomotil. It causes low motility. Like, you can't mess that up, right? Yeah. All right. So it is an antidiarrheal and it is an opioid-like drug. Now, you can get this over the counter, but you know, what does opioid do? What do opioids do to your gut?
It stops.
They slow them down, right? That's why everybody on opioids gets constipated, right?
Yeah.
So they made an opioid-like drug. But like I said, you can buy this at CVS. But you just have to show your ID when you get it, okay? So because it is an opioid-like drug, it slows the intestinal contractions, but it has a high rate of abuse because
it's like an opiate.
You can get high as a kite on it. Then all the teenagers found out. They all went to CVS. And they all started buying shit tons of Diphenoxylate. And then what happened to them?
They had constipation?
I mean, like, such massive constipation, they were getting impacted, and then they were getting...
perforation.
Well, yes, they get impactions and then obstructions and perforations. So the pharmaceutical company was like, say less, I got this, okay? So they decided to add atropine to this drug. What is atropine?
The heart medication. Isn't that the one that you give when the patient is coding?
What does it do? It is the only drug that just increases heart rate. So what they added atropine for two reasons. Number one, they're like, it will make their heart rate go so fast that they won't take anymore. That's kind of fucked up. Yeah. Number two, what's your keyword for atropine? It is a anti... Have we had cardiac?
I know, yes, we did.
Okay, y'all.
The keyword?
Yeah. Atropine is a anti-cholinergic. What's your keyword for anticholinergic? Drying. So it dries them out even further. Okay, so you understand why they added atropine. It's messed up though, right? Yeah. I mean, I get it why they did it. Side effects. You will see the same side effects as you see with opioids. What's euphoria? I'm high as a kite. Yes. Constipation, pruritus. You know, opioids cause you to itch, right? Drowsiness. You know, when someone's on opioids. And they're like, what's xerostomia?
Dry mouth.
Dry mouth. Where'd that come from?
The atropine?
It's an anticholinergic. What about dry eyes?
The same thing.
Anticholinergic. Respiratory depression.
That's the
it's opioid-like. Tachycardia. Atropine. Obstruction and perforation. It slows down your gut so much, yes? It can cause toxic megacolon, which basically means if it's holding in all of your poop and then your colon keeps growing and growing and growing and growing, and then all the bacteria that was in your gut just starts to multiply and you get this massive super infection in your gut. Do you understand? Okay. So if a patient's going to take diphenoxylate, it's got to be for Crohn's. Okay. So you're going to tell them to make sure they're drinking plenty of fluid so that they don't get, super constipated, right? If they're like, oh, this drug makes me itch, I'm like, yeah, it does that. So just use an antihistamine. That'll help. Okay. Monitor that respiratory rate. Yes. Do not give this to patients with a history of addiction because that is rude. They may be very much trying to stay off of opioids, and then you just give them an antidiarrheal, not even asking that question. You know what I mean? And then they get that high from the opioid, and like you could cause them to relapse. Yeah. So you always need to ask that question. Obviously, don't give it to patients with severe tachycardia because, their heart's going to explode. Okay. We're going to implement anticholinergic care. What do you do when a patient's on an anticholinergic? This is the can't see, can't spit, can't pee, can't shit. So what do you do? Start with the can't see. How do you fix the dry eyes? How do you fix the dry eyes?
Eye drops.
You're going to do lubricating eye drops. How do you fix the dry mouth?
Liquids or gum.
Lots of liquids, gum. There's artificial saliva you can use as well. Okay. Can't pee. How do you fix urinary retention? Ma'am. Y'all, what is urinary retention? That you're not holding it in, you can't let it go. So it's in your bladder.
So you can do the...
So first you need to do a bladder scan. Well, first we palpate. Then we do a bladder scan. And then how do we get rid of the urine? Yes, you'll have to get an order for a straight cath. Okay. And then can't shit. So obviously increase fluids and monitor bowel movements. Do not give if a patient has a gut infection. Have I made that clear enough?
Yes.
Guess how you treat an overdose? Narcan, because it's an opioid. Yes. So we use naloxone or Narcan. All right. Do you understand diphenoxylate? Do you understand diphenoxylate?
Yes.
All right. Let's go to loperamide. Same concept. It's still an antidiarrheal, and it is the structural analog of meperidine. Does anybody know what meperidine is?
Is that an antipsychotic?
No. Loperamide, anyone? It's Demerol. Do you know what Demerol is? It's an opioid. All right, so it's just like an opioid. Okay. So it's again an opioid-like drug, so it slows intestinal contractions, but it doesn't give you the high. So this one doesn't have as much abuse potential because they don't get a high from it. So why would you want to take a whole bunch of it? It does not cross the blood-brain barrier, so you won't see the sedation and all of that you saw with diphenoxylate. But it can cause abdominal pain, constipation. It can still cause a little xerostomia, which is dry mouth. Okay. It can slow down your gut so much that it causes a paralytic ileus. What's a paralytic ileus? Your gut is paralyzed. That's a risk.
Yes.
Okay. And there's our friend again, toxic megacolon. Do not use for a gut infection. How do I know if they have a gut infection? One of the first things I'm going to ask is, do you have blood or mucus in your stool? Now, sometimes Crohn's will have blood in the stool because it's a severe inflammation. But most of the time, if anybody else has blood or mucus in the stool, it usually is like Salmonella, Shigella, something like that. Okay. Monitor bowel sounds and bowel movements. That's a given. Yeah. All right. The next one. This drug is awful. It was pulled from the market because it killed everybody. And then somebody paid to get it right back on the market. And here we are. Okay. It is called Alosetron, but you will lose 100% when you take this drug. Okay. So it is a 5-HT3 antagonist. Anybody know what 5-HT3 is? It is serotonin. Write that down because we're going to have a lot of drugs in this class that are 5-HT3 something. So 5-HT3 means
serotonin.
Where is serotonin absorbed and produced?
In the brain.
Ma'am, you just told me earlier it was not. Okay. So it is produced and absorbed in the gut. So this is a serotonin antagonist. Okay. Serotonin causes your gut to move. Okay. So if it's an antagonist, it is going to slow down the intestinal motility. This drug slowed down the intestinal motility so much that people were getting constipation, impaction, perforation, obstruction, toxic megacolon, and colonic ischemia. What is colonic ischemia?
Your colon has ischemia.
What's ischemia?
Stop of blood flow?
Yeah, what happens if you don't have any blood flow to your gut?
You die?
It dies, and then so do you. They approved this drug for women only, and all these women started dying of a colonic ischemia, and their gut was dying, and they were getting septic. So many women died that they had to pull it from the market. It is back. This is one of the, I want y'all to hear me when I say this. This is the only time in pharm that you will report constipation from a drug. Okay, you know, with opioids, they cause constipation. Like a million different drugs cause. I ain't calling nobody. Okay.
So why do they give this medication?
What do you mean?
Like, who do they give it to?
All of these are inflammatory bowel disease drugs. Remember?
Yeah.
We're under ulcerative colitis and Crohn's.
Okay.
So they give it to women with ulcerative colitis or Crohn's.
Okay.
Okay. So it's approved only for women. Very dangerous drug, Obby. If they already have constipation, you better not, because it will cause a life-threatening event. So if they report constipation, you need to have them discontinue it immediately before they perf.
Why is it only given to women?
It's only approved for women. So they only applied to give it to women. Rude.
Right.
I mean, basically. Because remember when we talked about digoxin and it increases the mortality rate in women?
Yeah.
Okay. Next is Alosetron. Who loses?
Women.
Okay. And it will make you lose your life. Are you with me?
Yes.
Okay. Next one is Sulfasalazine. What is sulfa? We've already covered that.
Sulfa?
Mm-hmm.
A drug. Sulfa reaction?
Yeah, the number one side effect of sulfa is hypersensitivity reaction. So what is sulfa? Ma'am, what is sulfa? No, what is the drug sulfa? Why do you keep saying allergy? Y'all have heard tons of people are allergic to sulfa, right? Then what is it?
Sulfur.
Oh my God.
Iodine.
No, y'all, where are y'all getting this? We already had this drug.
It's like an antibacterial.
It's an antibiotic. Thank you, ma'am. Y'all, are y'all okay? Because you're going to have a cumulative final and y'all need to remember these drugs because you're going to keep seeing them come up. So sulfa is an antibiotic. What is ASA?
Aspirin.
Okay, thank you. And what is aspirin?
An antiplatelet aggregate.
It is. What else is it though? What else do you use it for? Okay, it is an antipyretic. What else do you use it for? What's the drug class of aspirin?
Isn't it
Okay, what's an NSAID?
Non-steroidal.
Anti-inflammatory. What are we talking about? Inflammatory bowel disease. So this drug is half antibiotic, half NSAID.
Okay.
So that's why we're using it for these patients' gut, because they get a lot of gut infections because their gut is constantly inflamed and irritated. The aspirin will help to decrease the inflammation. You with me? It is what we call a 5-aminosalicylate. What is salicylic acid? It is an aminosalicylate, ASA.
Aspirin?
That's aspirin. Where do you think the ASA came from? Aminosalicylate. Okay? Oh, help us, Lord. Y'all make me work so hard today for no freaking reason. All right, so this is half ASA, which is an anti-inflammatory, and half sulfa, which is an antibiotic. Okay. So you're going to see the side effects from those two drugs. Okay. So remember, you told me the number one side effect of sulfa was hypersensitivity reaction. So I'm already going to see that. You see? You with me? Okay.
Rash.
Yep. It can cause fever, rash. It can cause your urine to turn orange. Nobody cares. Okay. You have to let the patient know that, but blah, blah, blah. NSAIDs are hard on which organ?
The kidney.
The kidneys. Very good. Okay. Sulfa was hard on kidney and liver. So that's why you're going to see kidney and liver. Okay. It can cause SJS. What's SJS?
The
Stevens-Johnson syndrome. Remember, that's a liver thing, right?
Yes.
Agranulocytosis. Anytime you hear that in pharm, what do you need to report?
Fever and
Sore throat. Sore throat and fever. I'm going to make y'all repeat that 120 times. You're going to see it on every sheet. When a drug causes agranulocytosis, what do you tell them to report? Sore throat and fever. Agranulocytosis.
Fever and sore throat.
I'm going to wait till y'all say it 100. I'm not kidding. Agranulocytosis.
Fever and sore throat.
Agranulocytosis.
Fever and sore throat.
Thank you. It also can cause bone marrow suppression. Basically more like it's crazy blood. Have we talked about crazy blood?
Yeah, dyscrasia.
Okay, like blood dyscrasias? Yes, because liver, right?
Yes.
All right, so you're going to watch the CBC because blood dyscrasias, LFTs,
The liver.
liver, BUN and creatinine,
Kidney.
kidney. Watch for allergic reactions. Give me your big girl words for anaphylaxis.
Angioedema.
Angioedema,
Pruritus,
pruritus, urticaria, and wheezing. Very good. It is safe in pregnancy and in lactation. That's kind of big to know. But you should not give if they have an aspirin allergy because it's made of
Aspirin.
Okay. Report. Oh, look at that. Sore throat and fever.
Mhm.
Okay. This drug is a heavy hitter, so you do have to monitor serum levels every 3 months. And you do need to report a rash because what could it be?
SJS.
Could be SJS. It could also be a hypersensitivity reaction.
Yes.
Yeah? All right, last one on this page. Can we make it?
Yes.
Yes, we can. All right. Infliximab. Have we talked about the MABs yet?
Yeah, Mab and Sept.
MAB and Sept.
Yeah, Sept.
What do you know about it? What'd I tell you? What's your red flag? You're like, yes, we have talked about it. No, I do not remember. Get out your red flag sheets. Because y'all are missing some giant red flags today. Get out a red flag sheet. If you don't have one, you better start one today.
No, I have one. I just forgot my stuff.
Okay. Red flag sheet.
Oh, shoot. Yeah.
Let's go back and go over the big red flags that you guys missed today. Okay?
Okay.
Okay. What is your big red flag sign and symptom for the gut?
Rigid board-like syndrome.
Rigid board-like abdomen. What does that mean you have? Peritonitis.
Peritonitis.
When a drug causes agranulocytosis, what do you report?
Sore throat.
Sore throat and fever. Oh God, I love that noise. Not the train, the writing part. What is your acronym for MAGTOX?
Burp.
All right, what does BURP stand for? Bradycardia.
Urine output is lower.
Urine output
Output
decreased.
The R
Respiratory rate
rate
decreased.
and then
Patellar
patellar
reflexes
reflexes
decreased. Wasn't there something else I yelled at y'all for today? Oh, what are the 2 drugs of choice for hepatic encephalopathy?
neomycin and
Lactulose. Lactulose and neomycin. Lactulose and neomycin. How do you know those are working?
because they're pooping.
You're pooping. What is sulfa?
It's an antibiotic.
What is ASA?
Aspirin.
What is 5-HT3?
Serotonin.
Very good. Now we on it. Anytime you see a drug that ends in MAB or SEPT, C-E-P-T, what is your keyword? Infection. What's your keyword?
Infection.
Keyword.
Infection.
MAB or SEPT?
Infection.
MAB or SEPT?
Maberse.
Yeah. I'm telling y'all, you will have these drugs in probably 4 or 5 modules in Pharm. They are such strong immunosuppressants that any tiny infection your patient gets could kill them. So you have to do a full workup on this patient before they start this med. And if they complain of any signs and symptoms that could possibly be an infection, we're not starting it.
Okay.
You have to get a PPD for the patients that are on MAB or SEPT, the TB skin test. If they get TB, they will die on this medication because it decreases their immune system so much. MAB or SEPT, keyword.
Infection.
Infection. All right. So in this case, why are we using Infliximab? Why am I using an immunosuppressant? What are we studying?
Oh, well, we're doing the
Inflammatory bowel disease. What is Crohn's?
Crohn's is autoimmune.
Autoimmune, right? So we're going to suppress the immune system because autoimmune, it's overreactive, correct?
Yes.
It is also called a TNF inhibitor. What does TNF stand for?
Total
Tumor.
Necrosis.
Factor. It's part of your white blood cell system, and it's going to inhibit all of your white blood cells. So what are you going to be at high risk of? Infection. What's your keyword for MAB or SEPT? Infection. Okay. So it is a massive immune suppressant. Okay. This is given IV, and you will have a massive infusion reaction that they actually consider, quote, normal. It includes fever, pruritus, urticaria, and chills. When you think they were allergic to it?
Right.
So you have to know to expect that, because that sounds like anaphylaxis, but you have to know like, oh yeah, she's on Infliximab. That just happens. Is that not your body's way of being like, no, thank you? Okay. It can also cause cardiopulmonary symptoms, like they may complain of chest pain or dyspnea, but they're not dying and nothing's wrong with their heart. It just makes you feel like you're dying.
Okay.
It can cause a severe infection, and no big deal. It just causes lymphoma. What is lymphoma?
Cancer of the lymph
Yeah,
nodes.
because it's a tumor necrosis factor inhibitor. So your Crohn's is better, but now you have cancer. What in the... All right, so there is an induction regimen. What does to induce mean? To start. So you're going to get it the first day you come in, that's 0 weeks. Okay, then you get it at 2 weeks, and you get it at 6 weeks. And then once they get you to where, you got plenty of this drug just roaming around in your body, you're going to go into maintenance regimen, which you only have to come in every 8 weeks and get shot up with this terrible drug. Okay. Monitor very closely for infection, and we're going to put them on neutropenic precautions. What's included in neutropenic precautions? What is neutropenia, by the way?
Neutrophils, your white blood cells.
So they're all very low, putting you
Yeah.
at high risk of infection, bacterial infection, right? So what's
Yeah.
included in neutropenic precautions? What can you not do?
Like shave.
This should go on red flag if you don't know that's bleeding. If you don't know these, you need to know, because you'll need to know them for med surge and every single class you'll have from here on out. So I will tell them to you one time, and then you're on your own after this. Okay. So what we do not want to happen is this patient to get an infection. Okay. So obviously we're going to do the big ones first. Good hand washing. Limit visitors. Right. No ill contacts. Like if you're sick, please don't come around me. Okay. Avoid large crowds. All of their food has to be like really cooked, because bacteria can live on the surface of foods, right? So like if they're going to get a steak or something, it has to be super well done. They cannot have any fresh fruits or vegetables. How come? They've got bacteria on them, right? And you can't wash all that off. So even like if they're going to have, they can have fruits and vegetables, but they have to be cooked. Okay. They cannot have sushi, Abby. It's raw. They cannot have anything that is unpasteurized, like unpasteurized milk or unpasteurized, pardon?
Right, unpasteurized eggs.
That's not it.
No, there is.
No. You're thinking of like...
Pasteurized.
No. I know what you're thinking of, but that's not what it means.
Okay.
You know what I'm talking, she's thinking of like where they are like free range. Like that's what you're thinking of, like raised in a pasture.
Okay.
Pasteurized is like, that's what she thought. I know it's a different word, but it sounds the same. I can understand what she'd think that. Pasteurized is like where they go through like this heating process where they heat all the bacteria out of it. It also takes all the nutrients out. Like they do it to our milk. Okay. So they can't have they couldn't have like raw cow's milk or something like that. Okay. And then they cannot have any fresh flowers in the room because they have fungus on them. Okay. So things that our body could naturally fight off, they cannot. Okay. So that's neutropenic precautions, because I don't want them to get an infection. You cannot start if they have an active infection. So question they often like to ask is, oh, your patient is due to start Infliximab today. The patient, which of the following, if reported by the patient, would you say something to the doctor? And it'll be like, oh, patient said she started having dysuria this morning. If it burns when she pees, she might have a UTI. And then what happens if I give her this drug? She can't fight it, and she'll get septic and she'll die. Okay, do we understand? Why all these drugs kill you? Like your disease didn't, but then you took a drug and it did. You have to do a PPD before you start therapy. What's a PPD?
The TB test?
TB skin test. If they are positive, you're not starting this today. And then monitor for lymphadenopathy. What is that?
Monitor for what?
Lymphadenopathy.
Your lymph nodes are swollen.
And why are they swollen?
Well, if it's on this drug, they're gonna want to see if it's cancer.
Yeah, that's a first sign and symptom of lymphoma or cancer of the lymph system. Do we understand?
Yes.
Questions for me on this?
No.